Mastering MS Advanced NCLEX-RN Questions and Answers. Hello everyone, welcome to Canadian Nurse Expert. Today we will discuss some advanced NCLEX-RN model questions related to multiple sclerosis. We'll dive deep into the complexities of this condition, covering everything from clinical manifestations and disease management to essential pharmacological knowledge and critical thinking skills. Remember, acing these challenging questions requires a solid understanding of the disease process and the ability to apply your nursing knowledge to real-life scenarios. So, let's get started. Our first scenario involves a client with MS who suddenly develops dysphagia. Remember, this means difficulty swallowing. What's your priority as the nurse? The answer is to immediately place the client on NPO and notify the healthcare provider. Why is this so crucial? Because dysphagia significantly increases the risk of aspiration. Imagine food or fluids going down the wrong pipe and ending up in the lungs. That's a recipe for aspiration pneumonia, a potentially life-threatening complication. Until the client can be evaluated by a provider or a speech-language pathologist, NPO is the safest course of action. Let's talk about disease management. Managing a chronic illness like multiple sclerosis requires a comprehensive approach that includes medication, lifestyle changes, and regular consultations with healthcare professionals. Imagine you're educating a client with relapsing remitting MS. This type of MS is characterized by episodes of new or increasing neurological symptoms, known as relapses, followed by periods of partial or complete recovery. Which statement from the client raises a red flag, indicating a need for further teaching? It's crucial to identify misunderstandings early to ensure effective disease management. The answer is, I can stop taking my medication once I feel better. This statement highlights a common misconception that can jeopardize the patient's health. This is a common misconception, and it's our job to set the record straight. Patients need to understand the importance of adhering to their prescribed treatment plan. Disease-modifying therapies, or DMTs, are not a cure for MS. However, they play a vital role in managing the disease by altering its course. They're designed to be taken long-term, even when symptoms seem to subside. Consistency in medication is key to preventing relapses and maintaining quality of life. These medications work tirelessly to slow down the progression of the disease and reduce the frequency and severity of relapses. They help in managing the symptoms and improving the overall prognosis. Stopping them without the guidance of a healthcare provider can have serious consequences, potentially triggering an exacerbation of symptoms. Always consult your healthcare team before making any changes to your treatment plan. Now, let's test your pharmacological knowledge. Picture a patient with MS who has just started taking baclofen for spasticity. Which side effect should you, as the nurse, be particularly vigilant about? The answer is sedation and dizziness. Baclofen is a muscle relaxant that works centrally, meaning it acts on the central nervous system. While effective in reducing spasticity, it can also cause some unwanted side effects, primarily related to CNS depression. Sedation, dizziness, and even hypotonia or decreased muscle tone are all potential side effects. These effects can significantly increase the risk of falls, especially in patients with MS who may already have mobility issues. Chapter 4: Diagnostic Reasoning. Time for some diagnostic reasoning. This is a critical skill that healthcare professionals must master to provide accurate and effective patient care. Imagine a patient walks in with complaints of blurry vision, fatigue, and intermittent numbness in their legs. These symptoms can be quite concerning and point towards a variety of potential diagnoses. An MRI reveals the presence of multiple sclerotic plaques. This finding is significant and suggests a neurological condition. Now, which additional test would provide the most compelling evidence to support an MS diagnosis? This is where the diagnostic reasoning process becomes crucial. The answer is a cerebrospinal fluid analysis, or CSF analysis. This test can provide critical information that complements the MRI findings. While an MRI can reveal those telltale lesions in the brain and spinal cord, CSF analysis delves deeper into the biochemical environment of the central nervous system. It can detect specific markers that are highly suggestive of MS, providing a more comprehensive understanding of the patient's condition. We're talking about oligoclonal bands, which are abnormal proteins found in the cerebrospinal fluid and elevated levels of IgG, an immunoglobulin that indicates an immune response within the central nervous system. These findings, combined with the clinical presentation and MRI results, paint a much clearer picture of the patient's health status, helping to confirm or rule out MS. This comprehensive approach ensures that the diagnosis is accurate and that the patient receives the most appropriate care. Chapter 5. Critical Thinking in Prioritization. Prioritization is key in nursing. It's not just about doing tasks, but about doing the right tasks at the right time. Let's say you're caring for a client with MS who's dealing with a triple whammy: decreased mobility, spasticity, and urinary retention. Each of these issues requires attention, but not all at once. Out of the following interventions, which one demands your immediate attention? This is where critical thinking comes into play. The answer is teaching the client self-catheterization techniques. This might seem like a simple task, but it has profound implications for the patient's health. While all the options hold value, urinary retention poses the most immediate threat. Addressing it first can prevent a cascade of other health issues. Think about it. A buildup of urine in the bladder can lead to discomfort, urinary tract infections, and even kidney problems. These complications can escalate quickly if not managed promptly. Self-catheterization provides a way to empty the bladder effectively and safely, preventing complications and preserving kidney function. It empowers the patient to manage their condition independently. Once this urgent need is addressed, you can shift your focus to other aspects of care. This approach ensures that the most critical issues are managed first, paving the way for comprehensive and effective patient care. Chapter 6. Psychosocial Assessment. Nursing care extends beyond the physical realm. Imagine a patient with MS who constantly expresses feelings of worthlessness and breaks down in tears frequently during your interactions. What nursing diagnosis best captures their emotional state? The answer is ineffective coping. MS is a life-altering diagnosis, and it's natural for patients to experience a roller coaster of emotions. Ineffective coping speaks to the challenges they face in adapting to their condition, both emotionally and behaviorally. Recognizing this allows us to provide the support they need, whether it's through counseling, support groups, or simply a listening ear. Chapter 7. Mobility and Safety. Let's talk mobility and safety. You're instructing a client with multiple sclerosis who's experiencing ataxia, a lack of coordination. Which piece of advice should you emphasize? The answer is to use weighted utensils to minimize tremors while eating. Ataxia and intention tremors can make even the simplest tasks seem impossible. Weighted utensils provide stability, making it easier for the client to maintain control during meals. This small adjustment can make a world of difference in their independence and quality of life. Chapter 8. Disease Course Interpretation. Understanding the disease course is crucial. Which finding strongly suggests a progression from relapsing-remitting MS to secondary progressive MS? The answer is a gradual neurological decline without any periods of recovery between attacks. Relapsing-remitting MS is characterized by periods of symptom flare-ups, followed by periods of remission. However, in secondary progressive MS, the disease transitions into a phase of steady deterioration. The absence of those characteristic periods of recovery between relapses is a clear indication that the disease is progressing. Chapter 9. Patient Education. Patient education is paramount. What's the most important message to convey to a patient newly diagnosed with MS regarding lifestyle modifications? The answer is to emphasize the importance of a balanced routine that includes both rest and mild to moderate exercise. Fatigue is a common and often debilitating symptom of MS. While it's tempting to advise complete rest, a sedentary lifestyle can actually worsen fatigue and lead to muscle weakness. On the other hand, overexertion can also backfire, triggering fatigue and exacerbating symptoms. The key is finding that sweet spot, a balance of rest and gentle, regular exercise that helps manage fatigue, maintain strength, and improve overall well-being. Chapter 10. Nursing Delegation. Delegation is an essential skill. Imagine you're caring for a patient with MS. Which task can you safely delegate to a UAP, an unlicensed assistive personnel? The answer is assisting with ambulation using a walker. Remember, delegation is about assigning tasks within the UAP's scope of practice. They're trained to assist with basic care activities, such as helping patients walk safely with assistive devices. However, tasks that require clinical judgment, assessment skills, or specialized knowledge should always remain with the registered nurse. Until next time on Canadian Nurse Expert. So there you have it. We've tackled some seriously tough NCLEX questions about MS, and you know what? You aced them. Remember, knowledge is power, especially in the world of nursing. The more you know about complex conditions like MS, the better equipped you'll be to provide top-notch care to your patients. Keep studying, keep asking questions, and keep advocating for your patients. Until next time, stay curious and stay compassionate.